I have case study 3.2, An Apple a Day by Megan Rickle. We have all heard the stories of nightmarish doctor's visits. The doctor is dismissive and rude, patronizing, rushed or annoyed, or even prejudiced on some level. The advent of new technology has replaced long discussions with more accurate tests and scans. Some doctors' attitudes have driven away clients and have become hotbeds for malpractice lawsuits. Others feel the pressure to see more and more patients, thus reducing the time allowed for each individually. While, of course, accurate diagnoses are beneficial, is the seeming decrease in personal concern in doctors cause for alarm. A patient can rate their doctor on such sites as WebMD.com, but most doctors either are never aware of such surveys or they don't take them seriously, as these surveys are totally unmonitored. There are medical practice groups who perform medical surveys and take the results very seriously, even docking the pay of low-ranking physicians. Because of an increase of such requests, insurance companies are now adopting their own physician rating systems and will offer bonuses to highly rated physicians. While these incentives may not cure the case of the distant doctor, they may at least create awareness in the medical community regarding a patient's personal expectations. I think some of the main points in this case study is insurance companies are now rating physicians based off of satisfaction that their clients have, and pay is involved on whether the patient was satisfied or the patient wasn't satisfied, so the doctor is now low ranking and they have a pay decrease. I think that could lead to a rude, patronizing doctor. They also talk about how the technology has replaced some of the long discussions. That would also decrease a patient's satisfaction because patients feel like they don't get much one-on-one time with their doctor to truly tell them how they feel that their health is, other kind of signs and symptoms maybe aren't being realized because they aren't having long discussions. We're relying on technology to find issues at hand instead of one-on-one conversation. There's reduced time for each individual patient, which causes an issue when people feel like they don't get to speak about the whole issue, just a little bit of the issue, because they only have a certain allotted time and they might feel rushed by the doctor. There's also a pretty large waiting room time. I think that gives dissatisfaction to patients. They don't want to sit there and wait for the doctor, or they don't want to sit in the room and wait 30 minutes. The patients can rate their doctors on websites, which doesn't seem to do much harm, but the doctors don't really take these ratings seriously. And now these insurance companies are deciding to do ratings, and that's a little bit more serious because it can impact their pay and the amount of patients that they have on a daily basis. But why are we so focused on patient satisfaction in healthcare? Everything revolves around if the patient's happy. Imagine a scenario where a mother brings in her daughter who she thinks has an ear infection. She believes that the infection must be treated with antibiotics. Now, she's very adamant that she knows the right way to heal her daughter, but the doctor doesn't want to make the mother mad and get a low satisfaction rate, because this leads to lower pay. So he ends up giving the mother the antibiotics that she thinks is going to cure this ear infection. The daughter ends up with a superbug because it's not the right antibiotic. She didn't even need antibiotics. I think this can happen a lot in cases where patients are very needy, or they think they know what they want. They think they know what's best for them. But all we want to do, and all we do in healthcare, is try to satisfy them. Why don't we think about patient outcomes? What are the outcomes for these doctors in terms of, are their patients healthy? Are their patients living longer? I think the outcomes on that standard are a lot more meaningful than how satisfied someone is, because these patients could be completely satisfied, but they might not be in great health. they could be in worse health. Doctors have to walk on eggshells sometimes, and not just doctors, this also includes other healthcare professionals, because if they don't walk on eggshells, they're going to piss the wrong person off, and they're going to get a terrible rating. I think it's really sad how everything's gone to patient satisfaction, and we all are concerned about doing the right thing and making the best ethical decision, when we have to revolve our care around satisfying this patient. So we know that this patient is going to be satisfied by getting their narcotics, but they have a narcotic abuse. But if they're not satisfied by not getting their prescriptions, then some of these doctors want to keep giving these prescriptions, because then they get higher incentives from these insurance companies. I don't know how they would monitor these patient outcomes. I know patient satisfaction rates are done by surveys, and that's a little bit easier to judge. The patient outcomes health-wise might be a little bit harder to judge than the patient satisfaction, because it's usually just a simple questionnaire or a simple 3 questions that they ask the patient. And then we know if they're satisfied, if they're not satisfied. I think patient outcomes would entail a little bit more statistics on the patient population and how healthy they are, vital signs, yearly visits. But I think it's a lot more feasible for doctors. Shouldn't we pay the doctors who have better patient outcomes? We need to pay them more than the ones who don't have better patient outcomes. Because obviously they're doing something right. They're recognizing something that some of these doctors aren't recognizing when they should be recognizing them. I think there's a lot of different views that you could take off of this case study. I don't think doctors intentionally harm people. Well, not all of them, but it's very easy to let the patient be right to get them to be satisfied. I don't think the financial reward that's been offered by insurance companies is going to make this situation any better. I think it's going to make the situation worse, if anything, because once you get greed involved, things tend to get worse. I think we need to focus on health outcomes and who's making these patients the healthiest overall.